Welcome back to my no-name channel. I'm Bruce Pullman, and this is another Bali COVID-19 update. And this is one that I may have my sound problems finally worked out. I don't know. We're going to see. Today I'm not using my Pocket. I'm using my Lumix, shooting at 4K, and I'm using the Rode mic, and yeah, we're gonna see how this works. If it's gonna cut down the wind, because it's windy, like it always is, and it's a beautiful day in Bali today. So yeah, let's see. And what's the news like in Bali? Let's take a look. And the numbers are going up again. And yesterday, 49 new cases. We are now up to 1,263 with 730 recovered. 11 deaths. We're up to 11 deaths now, and 422 active cases. And I'll be talking a little shortly about one of the problems that all these new cases are causing us. And the local cases, the new cases are local transmissions. There's a image up here that shows the distribution of cases around the island. So there's local transmissions, and there's still problems with the market. And the Denpasar area is still the hot place right now. So, well, let's see. Let's take a look at some of the numbers here. There are 64 healthcare workers that are in all these cases, these 1,263 cases, 64 healthcare workers that have been infected by patients, some not knowing that they were sick and coming in for something else. And it turned out that they were positive, and the medical workers were not wearing protective equipment. In one case, a man came in, he knew he was positive, did not tell anybody, he was treated for something else, and he infected one of the medical care workers. And so this is a serious problem. We can't afford to lose medical care workers in Bali. So what can we do? Hope that people are truthful and that they're aware, and if they think that they have the virus, that they tell people at the hospital when they show up. And I want to just for a minute look at the numbers of the ages, because there's been a lot of talk everywhere in the world, but even here among expat people, well, people that say they're expats, I don't know if they actually live in Bali or not. Well, it only affects people over 80 or people over 70, people that are old and sick. Well, one, that's not a good argument. We take care of everybody, whether they're old or sick. So that's just obnoxious. And just take a look at some of the numbers from the cases yesterday. Ages: 29, 25, 61, 40, 22, 54, 57, 45, 41, 23. Hear any 80-year-olds in there? No. This is an equal opportunity virus. It infects everybody. We've already had babies dying here. So if you're one of those people that says, oh yeah, it only affects old people, and so, you know, I'm cool and I'm young and I go out, and if you're old and afraid, stay inside. Why should you infringe on my freedom? Okay, so there's my rant. You know, as the father of a healthcare worker, I am really sensitive about this. Get with the program or get out. Okay, good news. Sea Turtle restaurant closed. Okay, sea turtle restaurants. Sea turtles are protected. Sea turtles have been a part of Balinese diet for a long time. They're very popular, but they're protected. And fortunately, due to some local informant. A raid was carried out on a Jimbaran restaurant serving sea turtles, and it was closed down, and the owner was arrested. And a large amount of chopped meat, and I'm not going to include that picture because it's kind of gross here. Of course, it's in Indonesian paper. They don't care about gross pictures. But in addition to the chopped meat that they got, they also confiscated 12 live sea turtles. So, hooray. Hopefully they can be put back in the ocean, rehabilitated. I'm not sure what they're going to do with them. In addition to the 12 still alive, there were 20 skeletons and more meat stored away in a refrigerator. So, good news. Some sea turtles are rescued. It's a shame when people eat that. Okay, so now some not so good news. So I was saying before that this increase in cases is causing a problem. What's the problem? The problem is hospital isolation rooms are reaching capacity. We're getting to the point where if we keep getting an increase, we're going to have a medical crisis in terms of where you're going to put sick people. And this is happening in other places as well. I was just talking to a doctor in Korea last night. He told me that having the same problem. They're having to increase places because they're full in some places, and they can't treat people with other illnesses because they've got COVID-19 patients. So, where? Well, we've got, let me take my glasses off here, Sanjiwani Hospital, Gianyar, isolation rooms are full. Link is down below. And Sangla Hospital, right, our big hospital here, is almost at capacity. It has 70 isolation rooms, and 62 are currently being occupied. And so cases that are not critical are going to be rerouted, stuck in isolation rooms in hotels. So we still have a lot of hotels empty, and so people have been being put in hotels for observation, for quarantine. Yeah, we've got to cut down on the cases, and we cut down on the cases by wearing masks, by practicing social discipline and social distancing. Now, one of the things I've heard on a number of expat sites is, oh, the locals are getting away with this, they're not doing it. Up here in Singaraja, almost everybody, when I was out with Zoe and Masha the Bear yesterday, almost everybody had a mask on. I didn't run into any foreigners. There aren't many foreigners around Singaraja. But on one of the Facebook sites for North Bali, there were some foreign residents complaining that they were in some of the popular food shopping places for Westerners, Abedi, which is in Singaraja, and we shop at some time. Papitos, which is over in Lavina, and I've never been to. That there were foreigners there shopping, not wearing masks, even though everybody inside were wearing masks, all the staff. Put the mask on. I talked about yesterday, if you were able to get over my audio problems, about the deportation. And so let's look a little bit at deportation for a minute. This is an article, it's not about Bali specifically, but it relates to what's happening here. This is in Singapore. Four British men have been banned from working in Singapore after they went on a pub crawl. This is back in May. It was, at the time, restrictions. You weren't allowed to go and buy alcohol and drink it in public. You had to take it home with you. They went to a pub crawl, hit 3 bars, got on social media. Social media is one of the ways that people are keeping track of what's going on. Say what you want about tattling on people, but if people can't take responsibility for their behavior, somebody's going to take responsibility for it. this is not an issue of freedom. I'm free to do whatever I want. Hear this from people on social media. You're not free to do what you want if it endangers somebody else. And so these guys, the photos were on social media. They went viral. Singaporean residents were very upset that how come we have to obey the law, and if we don't, we get fined, and these foreigners get to do this and get away with it. Well, they were apprehended, went to trial, they pleaded guilty, and they've been banned from working in Singapore, as well as an American couple who were also fined for consuming alcohol outside during restriction periods. So, how does that relate to here? Well, in Korea and in Singapore, people are being fined, foreigners are being fined and deported for violating the rules. And as immigration has, and I said this yesterday, maybe you didn't hear it, as immigration has posted widely, if you don't follow the regulations, you are subject to deportation. So it looks like Balinese authorities are getting more serious, like Singapore and South Korea. It's unfortunate that this has to happen, but people aren't taking responsibility. And so, as much as I hate to see government get involved in arresting people and deporting them, what are you going to do? This is a case of getting Bali back on its feet and getting back to work and getting tourists here so that people can have jobs and survive. And it's not going to happen when people keep violating the rules. Take a look at the U.S. Okay, and so it's going to be short. What else? Let's go to the Normal Bali Open. Okay, Normal Bali Open. Well, some good news and some, just information. Good news. Pandawa Beach is ready for the new normal, according to the Regent of Badung. He said this week that they are ready to go. The infrastructure is set up for meeting the new normal, and SOP, standard operating procedures, are in effect. They have sinks and hand sanitizers and other procedures, including the preparation and readiness of the local community to welcome tourists when Bali is back open. We'll get to that in a minute. Even so, there's more that can be done, he said, including putting a helipad in and fixing lighting arrangements and rearranging the sellers' stalls so that they're more aesthetically pleasing. So they want to make visitors, both domestic and international, more comfortable, feeling like they're safe, as well as pleasing the eye. So good news. They're ready to go. And what to expect in the new Normal Bali. Okay, this is interesting. So I've touched on this before. The Balinese government's still being pressured by players in the tourist industry to open up in July, which is just a couple of days from now. But with the numbers today, that's not going to happen. So the Association of Indonesian Tour and Travel Agencies, ASITA, wants to open up in July. July 1st ain't going to happen. And so this is from the Bali Hotels Association. They've got 158 members, general managers of some of the biggest hotels in Bali, and they prepared new protocols for tourists when they arrive. And what are they? No buffets. Now, if you've been in Bali, you know buffets are a big thing. Breakfast buffets, lunch buffets, dinner buffets. You get buffets for everything. Well, buffets are going to be out. Why? Because people are there, they're touching things. So no more buffets. I like the breakfast ones. The other ones I could do without, personally. Online check-in. Some hotels, especially the big ones, will be doing online check-in. This will minimize contact between staff and guests and make things much quicker and much smoother. Okay, that's good news. Social distancing. So there's going to be more outdoor dining where you can spread tables apart. Even in the places, in restaurants that don't have the outdoor seating capacity, there will be social distancing with setting up tables and menus. The old menus are going to be out. You're going to have, in some places, online menus. You're going to have chalkboard menus, so they can show you a chalkboard, or you can look at the chalkboard and see what's available. And one-use, single-use menus, you get that and you use it, and then it's recycled, so it's going to be made of recycled materials. And what else? Hand sanitizers and temperature checks everywhere for everybody. Good news, okay. And masks. Okay, people are going to be required in hotels to wear masks if they're in public spaces. Obviously, if you're in your room, you don't have to. But if you're going to be out in the lobby or wandering around, I don't know how the swimming pool is going to work. But people are going to be expected to wear a mask in public places. And there'll be signs, no mask, no entrance. And so that's good news. So what about dates? Okay, no dates. Still waiting to see if you remember a few videos ago I was talking about, and let's see, I put a link up here. I was talking about the plan that governor has, and with his three-part plan, and the first one is July 9th to open up for locals, and then in August for domestic, and September for international. With the numbers, I don't know how that's going to work. We haven't heard. I heard the schools are supposed to open on the 13th of July, which is only a couple weeks away. We don't know about that. Nothing has been said definitively on that. Checked with my granddaughter's parents, and they just heard the 13th. So we don't know about that. Booking, can you book for September? Yeah, like I said the other day, if you want to book, make sure that you can get a refund if it doesn't work. If you don't have to come in September, I would go for the Christmas holidays, right? Christmas holidays and New Year's. And there's testing being done on vaccines right now, human testing. And so it's possible that they could come up with a vaccine in the near future. Of course, there's still distribution and things that have to go on, but that's good news. So, yeah, and then there's a video that I talked about yesterday. It's a couple that are traveling around Bali, and I put a link there, and I'll put it again today, just in case you weren't able to hear what I said. I know somebody, and thanks for the comment, the sound wasn't bad, wasn't good. And it sounded better actually on my computer than it sounded when I went and looked at it on YouTube. And so I'll put it here. So they're traveling around, and they've got some really up-to-date information as they move around places. And you'll notice both of them wearing masks. Yeah. Okay. And so that's it for today. Thanks for viewing. Be safe. Follow the rules. And be kind to someone today. And see you next time.